all about HIV, Human Immunodeficiency Virus by Shelby Driesman. What is HIV? HIV is the human immunodeficiency virus that enters the patient's bloodstream and hijacks certain cells, such as CD4 and T cells. HIV hijacks the cells by using its enzymes such as reverse transcriptase and integrase to alter the CD4 and T cells' DNA. When the DNA of the host cell is altered, it cannot do its job effectively in the body. CD4 and T cells are the primary workers for the immune system. Therefore, when they are not doing their job effectively, the immune system is altered. When these altered cells bump into other cells, they can spread the virus. They can also replicate and increase the amount of virus in the body, called the viral load. When a person has a CD4 count below 200 or has acquired an opportunistic infection due to HIV, their HIV diagnosis has progressed to AIDS, which is acquired immune deficiency syndrome. How does it spread? The virus can spread in three main ways. Sexual, which is genital, anal, or oral contact with the exposure of mucous membranes to infected semen or vaginal secretions. Parenteral, which is the sharing of needles or equipment with contaminated blood, infected blood, or receiving contaminated blood products, or perinatal, which is transmission through the placenta, through blood and bodily fluids during the birth process, or from breast milk from an infected mother to a child. How can we protect ourselves? We can actually protect ourselves in many ways. This is important because Yahia states that over the next 10 years, the HIV prevalence is expected to increase from 24% to 38% of the population, mostly because of the life-extending effect of the antiretroviral therapies, thus increasing the amount of people that can spread the virus. First and foremost, early diagnosis and treatment with the ELISA or Western blot test can identify and decrease the spread of the virus. Sexual protection. Well, wear condoms. This can protect one from seminal and vaginal fluids. If participating in other sexual routes, one can wear latex gloves or a dental dam. If a sexual participant is HIV, they can protect spreading their virus to their partner by decreasing their own viral load by adhering to the medication regimen. CD4 states that treatment is a powerful tool in preventing sexual transmission of HIV, but it works only as long as the HIV positive partner keeps it to an undetectable viral load. To stay in an undetectable viral load, people with HIV must take their HIV medication every day as prescribed. In CDC, that was reported by CDC. If an HIV negative person wants to protect themselves from getting the virus from their HIV positive partner, they can take prophylactic measures by taking Truvada when having sex with the HIV positive person. All routes of sexual activity can put one at risk, but the anal route is especially risky due to the increased ability to tear. This makes it an easier access for the virus to enter the bloodstream. Parenteral protection. IV drug users are at risk. Abstinence from IV drug use is the most preferred. If they're unwilling to abstain from IV drug use, teach them how to clean needles by shaking the needles in 1 to 10% bleach solution for 30 to 60 seconds. Healthcare workers are at an increased risk as well for accidental needle pokes. Therefore, they are recommended to adhere to safe needle discarding and seek post-exposure therapy immediately if they get poked. And of course, you want them to follow standard precautions while working. So if you're a healthcare worker, you need to follow the standard precautions. Perinatal. Perinatal transmission is the transmission of the virus interutero between mother and baby. Exposure can occur during the birth process due to exposure of blood and bodily fluids through the placenta or the breast milk. The best way to prevent this is to have the mother screened early on in the pregnancy. If the mother is positive, it is very important for her to adhere to her antiretroviral medications, such as HAART, which is highly active antiretroviral therapy, to decrease her own viral load. When there is less virus in the mom, there is less virus. There is a lower amount of virus in the body that is available to spread to the baby. What are symptoms of HIV? The symptoms of HIV vary between person to person, but it has been noted to have similar symptoms to the flu in the initial stages, being fatigue, tired, swollen lymph nodes, night sweats, weight loss, sore throat, and aching muscles are some of the symptoms related to HIV early on. How does HIV progress? Well, HIV progression varies from person to person. Some may develop an infection during the first 4 weeks, where others may take 10 years to develop any symptoms. That's a really long time. After the initial infection, symptoms tend to cease with time. However, the CD4 counts still slowly but surely continue to go out of business, which in the long run will arise new symptoms and increase the HIV positive person's susceptibility to acquiring infections. Like mentioned earlier, when the CD4 counts drop below 200, they are diagnosed with an opportunistic infection. Their HIV diagnosis progresses to a diagnosis of AIDS. And this doesn't have a certain time limit. It's just whenever that person gets to that level or gets an opportunistic infection. Well, what is the treatment of HIV? Well, there is no absolute cure to HIV. However, HIV positive persons can minimize the effects of the virus in many ways. They can follow the recommended medication regimen, such as highly active antiretroviral therapy known as HAART. This therapy is a combination of multiple effective antiretroviral therapies. Effective HAART often helps control the multiplication of HIV in infected patients and increases the amount of CD4 cells still working. Thus, it prolongs the asymptomatic phase of the infection. Slowly, the progression of the disease This slows the progression of the disease and also helps reduce the risk of transmission. And this was stated by Bahati in 2016. The patient, in combination with HAART therapy, can also live a healthy lifestyle. Eating a high protein, high calorie meal, getting plenty of rest, and drinking lots of water can boost the immune system that they have working right now. So the CD4 cells that are still in action. Another factor is eliminating the exposure of the HIV source. This can decrease the reintroduction of the virus, which in turn decreases the viral load. So basically, if you're continuously introducing the virus into your body, it's going to spike the amount of virus in your body. So if you're still using a contaminated needle, or you're still engaging in sexual activity with someone that is not treating their HIV, that can in turn boost your viral load even though you're treating your HIV. All right, so here's some questions. What is the CD4 count below for the diagnosis of AIDS? Well, it's not 800, it's not 400, and it's not 500. So it is 200. Yay. What therapy is the best therapy to decrease HIV viral load? Is it heart, yoga, doxycycline, or Tamiflu? It is heart, highly active antiretroviral therapy. What is the riskiest sexual practice? Anal, oral, vaginal, or hands to genitals? It is anal. And HIV negative partners can protect themselves from acquiring HIV virus best by taking Truvada, eating healthy, wearing a face mask during sex, or receiving treatment quickly after exposure. It is taking Truvada. It's taking Truvada because that's the best way they can protect themselves prophylactically, whereas getting treatment quickly after exposure, that is kind of a treatment method rather than a prevention method. Did you know 1.1 million people in the United States were living with HIV in the U.S. at the end of 2016? 14%, or 1 in 7 people living with HIV in the U.S. don't know it. Young people are the most likely to be unaware of their infection. According to CDC analysis in 2017, an estimated of 54.6% of young people aged 13 to 24 who were living with HIV were unaware of their infection. Get tested as soon as possible. Be open with your doctor. Prevent contracting the virus by using safe sex practices or prophylactic therapy if applicable. If you are an intravenous drug user, connect with drug abstinence programs or safe syringe programs. If you are HIV positive, seek treatment quickly and adhere to the therapy regimen. And this was my references for my PSA and slides.